So what are the pharmacokinetic principles that we had undergone, no, the last time that we had talked about? So this is the action of drugs in the body over a period of time, including the process of absorption, distribution, localization in the tissues, biotransformation, and excretion. So here, some of the books sometimes would include the liberation of the drug. Oftentimes, the liberation of the drug could take place outside of the body, especially if you are taking effervescence. No, just like with your, are you familiar with Beroca? Diba? So these tablets, diba, would liberate on its own and would be dissolved first in water before you would take them. So, meaning to say, partial degradation of the ones that had preserved that in a tablet would soon be mixed with water before you would take them. So absorption still would take place in the small intestines and not in the stomach. So distribution would take place later on the moment it would go through the first pass effect in the liver and then the biotransformation thereafter. So just like with your vitamin A is in a form of retinoic acid. So the moment, diba, you would take that through your multivitamins. Let's say those are in a form of effervescence, meaning to say, na mix mo siya una sa water and then you take that and then your liver would convert that into retinol. So retinol would just stay there in your liver and then after which it would go into the circulation. It would wait for your zinc. That's the mineral actually that would be responsible for its availability to your eyes. It's not automatically delivered into your eye. It needs a transport mechanism. Okay? So I hope you get that right. So, meaning to say, it's still under absorbable active form in a form of your retinoic acid. So, and then biotransformed into retinol in the liver because retinoic acid is not important in the eye, but the retinol. Okay? So, I hope you get that. And then excretion. So, before it would be eliminated, it would be transform it again into a metabolite that is more hydrophilic in order for it to be readily dissolved into the water so that it can be extracted fast. So in practical therapeutics, oftentimes we also encounter some drugs wherein it is not in active form first, like for example, a prodrug. A prodrug oftentimes would not or carry the inactive form. So, meaning to say, our body is or needs to convert that into an active form in order for it to be relevant to our body. So, an example of that is your sucralfate. So, it is in a non-absorbable form in a way that it would act as a cement, especially if we have an ulcer in the gastrointestinal tract. So can you just imagine if it is readily absorbable? So meaning to say the ulcer or the wounds, no? When we say ulcer, there is what? Wound formation already along the lining of the gut. So you need to put a plaster on top of it so that it would not destroy some of this epithelium. So that's why you need also a prodrug. So a prodrug can also be like so that it would not be destroyed by the acids in the stomach. So it would wait, no? So most often a drug is administered into one body compartment. And so for example, the gut and must move its site of action in another compartment. For example, going towards the brain. just like with your anti-seizure medication. So, meaning to say, it is a passing of one compartment to another. Which compartment again? From the gut, going into the bloodstream, then going into your brain. So this site requires what? Absorption and distribution, including permeating through the various barriers that separate these compartments. Oftentimes, we have also what we call a retinal barrier, 'di ba? Meron yung like retinal barrier in between. So, meron din tayong drug that would pass through that. And there's a lot of drug also that cannot pass through that barrier or even the blood-brain barrier. So, it is really made to a point that not all substances can enter that. Because why? If lahat na lang accessible sa utak, then definitely there are some chemicals that are actually in the circulation that can destroy our nervous system or the brain itself. So kaya meron tayong tinatawag na blood-brain barrier. For example, we have this what we call levodopa. So, di ba, levodopa oftentimes are given to Parkinson's disease. So, these drugs sometimes are degraded before it would enter the brain. And so that's why we need to add carbidopa in order to allow this drug to pass through this blood-brain barrier. Okay? Are you following? Or had you imagined the flow of the drug? So how about permeation? Permeation is via one, aqueous diffusion. When we say aqueous diffusion, it follows Fick's law of diffusion, meaning to say the higher the concentration, di ba no, it would go to where the lower concentration is, meaning to say between the compartment. So aqueous diffusion occurs within the larger aqueous compartments, like for example, interstitial space, no, or the cytosol, or if you would take a look at this, di ba? So this is your bloodstream. So if this is your bloodstream, this is your cellular um composition. Let's say from your blood vessel to the muscle. So this is the one in between. So that is what you call interstitial space. Okay? So when we say cytosol, that is inside your cell. Okay? So how about in the blood, in between the cells of the blood, we call it plasma. So those are the areas, no, where aqueous diffusion is really active and across epithelial membrane tight junctions and the endothelial lining of the blood vessels through aqueous pores that in some tissues permit the passage of the molecules as large as the molecular weight like 20,000 to 30,000. And then again, it follows Fick's law of diffusion, wherein these molecules is usually driven by a concentration gradient. When we say concentration gradient, you had this experiment during your biochem, wherein you had your chorizo skin, and then you place some of the chemicals inside the chorizo skin, and then you submerge the chorizo with the content in the vessel wherein there's only distilled water and no other salt solution in it. So you tested for the presence of sugar, salt, starch, remember? So those are the reasons why you need to check on it because you need to check whether either polar substances or non-polar substances can pass through that. That is actually an in vitro experiment of how our cells now react to this type of permeation. How about lipid diffusion? Lipid diffusion is via its, according to the bilipid layer. So In lipid diffusion, this is the most important limiting factor for drug permeation, especially in the eyes. So, because of the large number of the lipid barriers that separate the compartments of the body, and because these lipid barriers separate aqueous compartments, the lipid aqueous partition coefficient of the drug determines how readily the molecule moves between the aqueous and the lipid media. Or, di ba, once you blink, more often than not, the lipid portion in your tear film would be distributed. So kaya paminsan if you had your eye drops, 'di ba? Ang eye drops paminsan would have what? 90% um kumbaga excreted kung mapupunta saan sa inyong nasal cavity or your lacrimal drainage system. Why? Because of its lipid distribution in the eye. So that alone is a barrier too. So that's why 'di ba, mostly pag sinabi nating eye drops, kumbaga multiple doses ang binibigay. So the frequency or of the dosing or dosage would be multiple compared to that of ointments. Kasi because of this lipid barrier. How about with special carriers? Special carriers or special carrier molecules exist for many substances that are important for cell function and too large or too insoluble in lipid to diffuse passively through membranes, for example, peptides, amino acids, and glucose. For example, the glucose, no? So you cannot utilize glucose. Actually, the sugar would not be converted into energy if it cannot enter the cell. So it requires what? A special carrier. In the case of glucose, we call it glucose transporter. So, kumbaga, parang katulad yan ng security guard sa school, di ba? Titingnan kung ano ang ID mo, kung tiga DDC ka ba. So, example, new student ka. Pagkapasok mo, titingnan nila anong course mo. So, just like you, no, kumbaga, ikaw being the sugar and others would be amino acids, no? So, example, ito siya, iba ang course. So, iba din siya, like amino acid ba siya or peptide ba siya or other biomolecules no in the body. So, here, ihahatid lang siya ng security guard. Then, another like transport mechanism, meaning the guard no in each of the room, let's say the faculty, no? So bago ka makapasok, bubuksan muna ng isang faculty ang room bago ka makapasok sa ano. So just like with your glucose, if you are the glucose, then it needs what? Insulin. So the insulin activates the glucose transport mechanism in order for you to be activated. For a while, question. Okay? Are you following? So, just like in your eyes. So, kapag kailangan natin ng energy sa mata, di ba? Like for example, the one that you are using right now, the moment you read, the one on the screen. So, you need glucose for that. However, if the glucose would not be converted into energy, some of the chemicals no, in our eyes would tend to change that into other components. For example, sorbitol. So sorbitol actually, its accumulation in the lens, since it has higher affinity in the lens, can cause blurring of vision. So, kaya nagkakaroon ng cataract. So, even a simple sugar can actually cause diseases in the eyes. So, any question? I hope you're following with me and your imagination is that fast so that you or you correlate that with your previous lesson on biochemistry. So these carriers bring about movement by active transport or facilitated diffusion. And unlike passive diffusion, these are what? Selective, saturable, and inhibitable. So that's why if there would be derangement in some of these what we call this enzymes in the eye, like for example, depletion of the glutathione in the eye, it would have a fast progression of the cataract. Kaya paminsan pag bata pa, mapapansin natin kahit long-standing ang kanyang diabetes. But then again, the sugar is completely maintained, no? So again, this has something to do with your carriers. So meaning to say, if your insulin it becomes insensitive, meaning to say your pancreas daily would produce still insulin. However, they are insensitive at this time for the glucose. So it would not allow glucose. Kumbaga, hindi yan siya ihahatid doon sa gate. Di ba yung sabi ko, pagkapasok, meron kang security guard. So, meaning to say, ang magbibit-bit sa'yo, kunwari, ihahatid ka ng parents mo via car. So, that alone is your insulin. So, meaning to say, if it is insensitive, then that sugar could not be delivered to the cell, no, where it is needed. Okay? So, because many drugs are or resemble such naturally occurring peptides or amino acids or sugars, they can use these carriers to cross the membranes, or let's say what we call um, the ones that are carried by the plasma proteins, no? So meaning to say na envelope siya with the protein. So that's why it has what? It has gain entry, meaning to say mabilis siya masyadong makapasok sa cell. So kaya, 'di ba mapapansin nyo, meron tayong mga gamot na minutes lang mag-effect na kaagad siya. So just like with your anticonvulsant, 'di ba? Automatically, sometimes it would not follow the gastric emptying time of the patient, unlike with other drugs, like for example, paracetamol. It would take like around 1 hour, no, to 4 hours before it would reach the baroreceptors and lowers your temperature. So it is because of this idea that it is what? It is crossing the barrier. So that's why it requires a carrier mechanism. So how about endocytosis and exocytosis? So this is what happen if you have like viruses or vaccine. So just like with your vaccine, di ba? So it is on endocytosis. So just like with your virus, it acts via endocytosis. Our own cell tries to engulf it, and the moment that they would be many and had used all of the nucleic acids inside our cells, then it would go out through our cell with a mature virus through exocytosis. So it would enter via endocytosis and it would exit via exocytosis. So just like with your botulinum toxin, yung mga botox no na nilalagay sa mukha. So like para mawala daw yung wrinkle. Pag nagkamali ng insert actually on the botulinum toxin, that can actually cause death no to the patient. So instead of beauty, death ang ibibigay kasi death of the face. So wrong application of the drug itself because it is still toxin. However, it is just used for beautification. So that's why not all physicians are actually giving that out because it requires still another training for the botulinum toxin, no? So if the if the doctor is only allowed to give botulinum toxin via the body, hindi siya pwede via the face because the specialization for the face is different from that of the entire body. So, kaya mayroong iba na, ay, pwede lang ako mag-botox para sa ganitong klaseng sakit. Let's say dystonia. So, I can only give you the botox through the muscles. But I cannot give or administer botox on the face. It has a different specialization. So, kaya magkaiba yan sila. So that's why I'm really like amazed with some of those like the ones that are being reported in some of the social media na ginagawa lang ang botox sa bahay. 'Di ba? Nakita niyo yung pinakita ni um Jessica Soho na ano yung face, na distort ang face kasi sa bahay lang they do that at home. No? So believe naman ako doon. So, bakit hindi yan siya abruptly ma-change? Why? Because again, it acts via endocytosis. Our cell is the one that engulf that, meaning to say, it would go inside the cell at once. And it requires, di ba no? A lot of changes in the cell before it would go out from the cell. So this process is also responsible for the transport of vitamin B12. Diba, no? The only B vitamin that is really essential to all, no, in any age group. So B12. Why? Because our blood needs it in order for us to like have a good circulation, transport mechanism, and the iron to be transported into the hemoglobin so that this iron can bind to your to the oxygen, no, on the transport mechanism of your oxygen with the protein transferrin. So specific receptors for the transport proteins must be present for this process to work. So I think you had a very good grasp of this idea the moment you had talked about nucleic acids in your biochem. But anyway, I hope na-recall nyo as we go along with our discussion. So the reverse process is exocytosis, as what I have said. If the virus would mature, no? So ibig sabihin, marami na siya masyado doon sa cell. Kapag hindi niya na mapakinabangan yung cell, wala na siyang nakukuha doon. So the cell burst, before it would burst, the virus would go out from the cell via exocytosis. So just like this one. So ito din yun ang ginagamit natin the moment we transport the neurotransmitter. So just imagine this is a neuron. So you have this vesicle. We need to have what? Calcium ion in order for this to cleave out of your axon. So the moment it would cleave out of the axon, then you can deliver your neurotransmitter. So the same thing in the brain. Right? Remember in your physiology? So that is still a process called exocytosis. So we have these different transport molecules that is important in pharmacology. So the transporter, you have your norepinephrine reuptake from synapse. So this is the NET or your norepinephrine transporter or your SERT or your serotonin transporter. So this is the one that you need in having your serotonin reuptake from the synapse so that you can have a very good kumbaga margination of your red blood cells or the attraction of your platelet because kumbaga the magnifying capacity of your platelet would really require coming from your serotonin. Not only it is a happy hormone, so that you can have what? A good mood. No, it is also the one that is required in order for you to have good mood. Not only with the reward system in the brain, because the reward system in the brain is with dopamine. It's not with serotonin. But what makes you appreciate and be happy about anything is serotonin. But the rewarding system, no, the reward effect or the rewarding feeling that you would experience is coming from dopamine. It's two different things. So how about the VMAT? So this is the transport, no, of dopamine and norepinephrine into the adrenergic vesicles in the nerve endings. So that, di ba, if you feel happy and you feel ecstatic at the same time, that is because of dopamine na. So MDR1, the transport of many xenobiotics of the cells. And this is pharmacologically, this is the one that is increased expression confers resistance to certain anti-cancer drugs. Inhibition increases the blood levels of digoxin, just like the one with the CHF or congestive heart failure. And your MRP, like your leukotriene secretion, this is in response to allergic responses, no, tulad ng merong mga rhinitis pagkagising sa umaga, especially in sudden changes of the weather. So ngayon, mainit, tapos malamig, tapos pagkagabi biglang mag-congest ang ilong, pagkagising may rhinitis. That is actually because of leukotriene secretion. So this also confers resistance to certain anti-cancer and antifungal medications. And take note of the drugs, no, in the ionization of the drugs. So you have the weak acids, you have the acetaminophen. If you are abroad, you have acetaminophen. If you are in the Philippines, you have paracetamol. They are actually of the same family. So that is actually under weak acids, no? And then you have the weak bases like your albuterol. Again, in America, they don't have salbutamol, but only albuterol. They are of the same banana. So, salbutamol in the Philippines, albuterol in America. So you cannot, like for example, you are asthmatic and then you go to Canada or Australia or US and you are looking for salbutamol. They don't have salbutamol there, but albuterol. Okay? So they are actually from the weak bases. Oftentimes, the excretion of this weak acid, especially on patients with other morbidities wherein they have difficulty in excreting this kind of medication, we need to alkalinize the urine. So we add sodium bicarb in order for these weak acidic drugs to be excreted. So unlike with your weak bases, in order for this to be removed from the circulation, oftentimes we need to acidify the urine. So kabaliktaran siya. So meaning to say, we need to add ascorbic acid, no, in the circulation so that it would acidify the urine. Remember, vitamin C is 90% excreted, only 10% that is absorbed. So, kaya, mabilis lang din matanggal ang ibang gamot, no? Just like with your amiodarone, atropine, no? So, it would be removed, especially if it is together with vitamin C. That's why some of your doctors would tell you na bago mag-take ng food supplements, magpapaalam muna sa kanya. Kasi baka hindi pa nag-take effect yung gamot, naiihi nyo na siya. So halimbawa, some of the medications, kasi halos lahat umiinom ng vitamin C. Itong lahat ng gamot na to, kadalasan, hindi pa nila ma-maximize ang effect. Ma-excrete na siya the moment you pee. So, nawawala ang bisa. So, kaya, there is medyo contradictory idea on food supplements. Kasi some of the food supplements can actually cause no deterioration of these drugs. For example, your grapefruit juice. Grapefruit juice is the one of the most powerful antioxidant, natural antioxidant out in the market. Antioxidant as it can acidify also urine. So it can, if you have this kind of medication, so again, hindi nyo pa na-maximize yung gamot, maiihi nyo na ito agad. Kumbaga, in short, pati yung inyong atay, kaya niyang linisin. So, ganun siya ka-powerful. So, kawawa yung mga merong maintenance medication. Kasi ang iba, kasi marami ngayon nag-grapefruit juice kasi maganda talaga siya sa balat. So, it would make your skin finer. Some of the free radicals are actually removed. So, kaya maraming umiinom nito. So, ang problema lang, paminsan kasi hindi nakakausap ng maayos, 'di ba, bago bumili ang mga like, for example, yung mga may maintenance drugs, umiinom na kaagad nito. So, what happened is that it would just, these maintenance drugs would go away. So, halimbawa, kung hypertensive, baka ma-stroke patuloy. Alin ang pipiliin mo? Maganda ang iyong balat o ma-stroke ka? Yun ang ibig kong sabihin. So, some of this can actually allow some of the medication to be like, you know, removed from the circulation. So cells of the nephron, meaning to say this is in your kidneys. So this is trapping of the weak base like methamphetamine. So like shabu, di ba? So methamphetamine in the urine when the urine is more acidic than the blood. So that's why if yun yung kadalasan na ginagawa ng mga addicts, di ba? Katulad ng chronic shabu user and then screening time comes, most of the time, they would add up more vitamin C so that they can remove the methamphetamine fast in their circulation. Para pag drug test, negative na sila. O, diba? Ganon ang nangyayari. So, kaya inaalam talaga kung ano yung mga ginagawa ng mga addicts. Mautak man din yan sila. Okay? So, I think we need to have a break like 10 minutes. 10 minutes lang. Okay? And then we'll be back at exactly 5:05. Okay? 5:05.